I'm Ashley Ashbucker and I'm going to do my wound care pass-off today. So first thing I would do is I would gather my computer and look over the order information, and I see that we need to clean a wound. So we go ahead and gather our supplies for that. Gather our supplies. We've got our kits, our gloves, our sterile gloves, hand sanitizer. So we would go to the patient's room, knock, knock, knock. Hi, I'm Ashley, I'm your nurse for today, and I'm here to clean your wound. Can you provide me with your full name and your date of birth? Perfect, thank you. And I would verify the armband as well. And if it wasn't obvious, I did hand hygiene as well. And then, so about 30 minutes ago, I gave you morphine and your pain was at a 7. How are you feeling now? This pain's at a 3, so I'm okay to move forward with my wound care. So I'm gonna go ahead and get my patient in the position that I need them and make sure I have all my supplies in the areas that I need them. So first thing I'm gonna do is just get some gloves on. I've got a garbage can here, easy access. I'll be throwing my supplies in there and then placing the supplies in a red bag when we're finished. And would you like to be laying or sitting for this? They want to be sitting up a little bit, so I'm just gonna, is that good? Okay, that's good. And then I'm gonna go ahead, wheels are locked. I'm gonna get it up to a good working height. Okay, that's comfortable for me. And then I'm gonna go ahead and take the bed rails off. Go find the little yellow letter. All right, so now we can go ahead and begin getting you prepped for your wound care. So we're gonna go ahead and maintain your dignity here and just get the wound. You have an abdominal wound. Perfect, okay. Just get you nice and covered up here. I see that you already have a chuck in place, so that's great. So now I can go ahead and begin taking care of the wound. So I'm gonna remove this dressing, but I'm not gonna just like rip it off. I'm gonna remove it slowly in the order of hair growth without applying any pressure. And as I'm removing it, I've got it off now so I can look at it. So we have presence of serosanguinous discharge here. It's light pink. I don't smell an odor. It looks like it's no sign of pus or anything. So I would throw this directly into my garbage can. And then now we have our wound here, which we're gonna clean. But in order to clean, I need some sterile gloves. So I'm gonna go ahead and come over here, and my gloves are coming off. And I'm gonna do hand hygiene. And I'm gonna make sure that these are nice and dry before I put my gloves on. I kind of got a lot. Okay. All right, so I've got my first packet of sterile gloves here. So I'm just gonna peel it open. And we're gonna go ahead and open the packet. And we're gonna keep our hands kind of on this 1-inch border because this package is sterile. And now that it's touched my table, I don't really want to mess with like touching the underside. So I'm gonna go ahead and grab my non-dominant glove and stick my hand in here and just pull that on. And then I'm gonna go ahead and grab this one underneath the cuff. Okay, my gloves are now on, so I can go ahead and just get rid of those. My hands are up. So now I'm gonna go ahead and I'm gonna need 3 pairs of sterile gloves in this situation. So I didn't open my package, and this is considered not sterile. So I'm going to open it away from me. And now my gloves are not sterile, so I've got to change them again. So we're gonna do that. Gloves are off. Hand hygiene. And okay, we're grabbing our gloves, and we're gonna use these cute purple ones. So opening it up. Grabbing the glove and pulling that on. The cuff. And something a little bit tighter. Pulling those on. Okay. Now for real. I've got my sterile gloves on so I can set up my supplies to begin cleaning. So we're gonna go ahead and pick this up, careful not to shake it. And we're gonna just lay it out. And then we're gonna lay out our supplies, keeping a 1-inch border. And I like to break these up because I'll use one for each cleaning. Careful not to touch the outside of the container. So now I'm going to take my measurer, and we're going to measure it's about 5 inches by 1 inch. And then we also have a sterile Q-tip swab that we can measure the deepness by. So I'm gonna do that right before I change my gloves into sterile again, because I should have done that before I put sterile gloves on. So now I bought all of my supplies, and I'm gonna go ahead and clean it. So I'm gonna go ahead and dump this in. And our orders don't call for like irrigating the wound or anything. So we're gonna just dump this whole thing in here. And we're gonna throw it away. And we're gonna prep this bag. And we're gonna lay it on the bed. And place this here for you. Okay. And then we're gonna go ahead and we're gonna use a new swab for each one. So we're gonna just get them all nice and wet. And that saline so that they can be cleaned. And we're gonna start in the center and work out. And like I said, that garbage bag will go in here. So it's got biohazard. And then I'm gonna do top to bottom. Okay. And now that my wound is clean, I just need to dry it. So I'm gonna dry it in the same way that I cleaned it. So from the center out, top to bottom, top to bottom. And did that hurt at all? You're doing good? Great. So it's important to assess pain. Another thing to note is this patient doesn't have any tubes or drains, but if they did, we would clean them at that time. So now that the wound is clean, we need to go ahead and replace our bandage, but we need sterile gloves for that. So I'm gonna go ahead and take this first pair of sterile gloves off and hand hygiene. And I'm gonna go back and measure the depth of my wound because I failed to do that before putting my original pair of sterile gloves on. So I'm just gonna jump in real quick and do that. And make sure you get all 3 measurements on your patient so that you have that information to chart. Maybe. Gloves are a little tight. Okay, so you take your Q-tip swab. It's actually a wound measurement kit, so it's not a swab. And we're gonna go ahead and measure how deep it is. It's about 3 centimeters deep. Okay, so now we can go ahead and apply the dressing. So we are gonna go ahead and put sterile gloves on again for this technique. So we grab our gloves and we're gonna do a clean surface. And then I'm just gonna make sure that we hand sanitize again after we took off those other gloves. Okay. All right. And pull these ones on. I now have sterile gloves on, so I'll keep my hands up and I'm gonna go ahead and apply the dressing. The orders didn't call for any layer to be applied to the skin, but you can apply a layer so that your tape doesn't stick when you put your dressing on. But I have my dressing here and I'm gonna put the blue line up. It also doesn't call for like any ointment or anything. I would put that on as well if needed. So I've got my dressing on. And then I'm going to take my tape. I'm going to secure it according to company policy. Okay, it's secure. We don't need any gauze, so I'll go ahead and take my little label here and label that the time that I changed this dressing. I'll also put my signature on there. And then, so we'll just fill that whole thing out. And then, let's see, we don't need gauze, we don't need scissors. So now I'll begin cleaning up my supplies. So we'll keep this chuck on since we didn't get any fluid on you there. So just because I went close to his wound, I'll change my gloves again just to cover all of our bases. So hand hygiene. And then we can use regular gloves. And we'll do some cleanup and get our patient comfortable. So we'll get you tucked back in here. And we will raise your bed rail. And would you like like to remain sitting? He wants to be in this position, so we're gonna keep him there. I'm gonna go ahead and lower the bed, and then this bag is what we are going to take our garbage bag here. And we've got some supplies on the table that we'll throw away as well in here. Some policies have you keep the scissors, so we'll do that. And then we're gonna place the whole trash bag in this red biohazard bag. And you can twist that up and tie it. And then this goes where your biohazard goes in your clinic. So for now, I'm gonna put it over here. This is our biohazard area. And then gloves off, hand hygiene. We got the patient comfortable. I would give him a call light, and then I would follow up with you at least once a shift, if not sooner, according to orders. And then I go ahead and document everything, and yeah, just be sure to follow up and get everything charted. So you have a great day.